Okay, so we talked about the joint types, and remember the whole point of having joints is to have movements. So let's look at different kinds of movements. We can divide movements up into groups, and these are the groups. They're gliding movements, angular, circular, and then there's a group of movements called special. They're called special because you can only do them with certain body parts. Well, before we talk about those, I want you to look at this graphic, and it's a pretty good graphic. If you think about a pencil on a piece of paper, there are lots of ways to move this pencil. One thing is you can do is put the point on the paper, don't move the point, but then just slide it around. So keep the pencil straight up and down, but slide it around. That looks like a gliding movement. Or you can put the pencil point on the piece of paper, don't move that, but then lean the pencil in different directions. That looks like an angular movement. Or you can put the point on the piece of paper and then just spin it like this. Or you can rotate it like this. Those are circular movements. And so we can move things in different directions. So let's look at gliding movements first. So gliding movements are where bones slide or glide or slip over another similar surface. It happens between two flat surfaces. And we already talked about gliding joints. Well, gliding joints produce gliding movements. And so when we look at that, that's this kind of movement. And again, it's flat against flat. And so if we look inside the hand here, remember there are 8 little bones in here, and those 8 little bones are called carpals, and those little carpals have flat surfaces where they come into contact with the other carpals, flat surface. And when you do this with your hand, when you move it back and forth like this, and we're not talking about this movement, we're talking about what happens right in here. These movements just glide back and forth on the other bone. Again, it's flat against flat, and they just slip against or slide on each other. We can also have angular movements. So angular movements are when we change the angle at a joint. So if you remember from geometry or trigonometry or something, here we have an angle, and there's an angle in degrees right here. So we have 2 lines and where they come together, but this could also be 2 bones where they come together. What we can do is we can move them so that these are closer to each other. In other words, we're decreasing the angle. We can also move them so that they're further away from each other. So we're increasing the angle. And that works all the way up to 180 degrees. And some joints keep going. Well, if you decrease a joint angle, it's called flexion. If you increase the joint angle, it's called extension. If you go past 180 degrees, it's called hyperextension. Those are all in the anterior posterior plane. But you can also have angular movements in the lateral planes, but we don't call those flexion, extension, and hyperextension. They're called abduction and adduction. And then, even though we don't think of it, these circular movements are also considered angular. But here's our angular movements right here. So we hold this point like this, and then we lean it. And if you lean it this way, look, this angle's getting smaller. If you lean it this angle's getting bigger. And so let's look at these. We have flexion, extension, hyperextension, abduction, and adduction. So flexion is when you decrease the angle at a joint. And so if you bend your knee right here, look, it was a straight line like this. This is what it looked like. But you bent it this way, and as you do that, you're decreasing the angle. Same thing here. Here's the arm in the normal position. If you move this way, you're decreasing the angle. So that's flexion. If you increase the joint angle, it's called extension. So extension is the opposite of flexion. And so we're going to increase the joint angle up to 180 degrees. And so when I straighten my leg, so I'm going to go this way, and my leg's going to go back to this straight position. That is extension. When I bring my arm back to this position like this, that is extension. Remember, that's only up to 180 degrees. If you go past 180 degrees, it's called hyperextension. And so if you look at this arm. It went past 180 degrees this way. Here's 180. It went past, and so that's hyperextension. We can also see hyperextension here. So look, if you think about your head, this is the normal position of the head, but you can bend your head forward. You're decreasing the joint angle right here. You're decreasing it. It was like this, but now it's like this. We went from there to there. That's flexion. But when you raise your head back up, you're increasing the joint angle. It was here, and now it's here. You're increasing the joint angle. That's extension. But if you look up at the clouds or you look at the stars, you go past 180 degrees, and that's hyperextension. Same thing here with the trunk. If you bend forward, that's flexion. If you straighten back up, that's extension. If you bend backwards, that's hyperextension. Any questions about those three? We can also have movements in the lateral plane. Well, we don't want to use the same terms because it would be confusing. And so we use the terms abduction and adduction. Remember, we have a midline. So remember, there's this line that goes all the way down. So there's your head, your neck, your shoulders, your arms. They go all the way down. And so you can move toward the midline or away from the midline. If you move toward it, it's called adduction. If you move away from it, it's called abduction. So when you raise your arm out like this, that direction, here's the midline, you're moving away from the midline. And so that's abduction. But when you bring your hand back this way, you're going toward the midline, and so that's adduction. You can do it with your legs. You can do it with other body parts. So again, there's the midline right here. So there's our midline. And when you move this way, it's abduction. When you move this way, it's abduction. But when you move toward the midline, it's adduction. Adduction. This is also abduction and adduction. Remember, this person's in anatomical position. Their hands are like this. And so when you think about it, if you're moving toward the midline of the hand or away from the midline of the hand, and then we have circular movements. There are two types of circular movements. One of them is a spinning movement, that's called rotation. And one of them is sort of like windmills, cone-shaped, and that's circumduction. So this is rotation. It's just spinning. And look, the distance here and the distance here are the same. But if you look at circumduction, look, the distance here is this, but the outside is this. It's windmill shaped. And so if you do windmills with your arms or your legs, that's circumduction. So if you're spinning like this and it's cone shaped, that is circumduction. But if you're just spinning your head back and forth, like this, or the arm back and forth, you're just spinning it, That's rotation. So look, we can have rotation to the left, we can have rotation to the right. We can have lateral rotation, we can have medial rotation. But it's spinning. It's not cone-shaped. So rotation is happening right here. This bone is spinning right here. This bone spins on its own axis. Here you can see it in the head. You can do it with the torso right here. You can do it with the legs. You can do it with lots of different things. But rotation, again, is when it spins on its own axis. You can also do circumduction with lots of different body parts. You can do it with your arms. You can do it with your legs. So your legs can do the same thing. You can do it with your torso. You can do it with your neck. But remember, it's cone-shaped. Cone-shaped. One end is small, the other end is wide. It's cone-shaped. We also have these movements which are called special. And special movements are called that because they can only be done with certain body parts. There's some things we can only do with our hands. One of those is you can turn your palm up or you can turn your palm down. You can turn your palm anteriorly or you can turn it posteriorly. Well, if you do turn the palm up or anteriorly, that's called supination. And an easy way to remember this is if you supinate, you can hold soup in your hand. So look, this person could hold soup in their hand. That's supination. The opposite of that is when you turn the palm down or posteriorly, and that's called pronation. And if you pronate, you will pour it out. So you hold the soup in your hand, and then if you pronate, you'll pour it out. So this, you're going to pour it out. You can only do these movements with the hands. No other body parts can supinate or pronate. So supination, pronation. And look, remember we said that in anatomical position, these bones are parallel. So when you're in anatomical position, your hands are supinated. When you're in relaxed position, normal standing position, these bones cross and your hands are in the pronated position. Now sometimes people use supination and pronation for the feet, but that is wrong. Feet cannot supinate or pronate. Another thing that hands can do that no other body parts can do is that we can take our thumb and touch our fingers with it. We can touch each finger with our thumb. We can oppose the finger with the thumb. And so that's called opposition. We have opposable thumbs because they can oppose each other. And so the thumb can touch each finger just like this. And the reason we can do that is because the saddle joint that we have. And remember, only primates have this joint right here. And so only primates can do opposition. So look at this little joke. These are cows. Cows don't have thumbs. And so cows, they don't have opposable thumbs. They can't pick up stuff. So look, the phone is ringing and they can't answer it. There are also some movements that we can only make with our feet. Well, if you look at the feet, they're different from the other body parts. When you're in anatomical position, your feet are bent. Everything else is straight. Your legs are straight, your hips are straight, your vertebrae are straight, your arms are straight, but your feet are bent at the ankle. And so the feet are flexed already. And then another thing about feet is they have an arch in them. So when you move your feet in either direction, you're going to decrease the joint angle. So if I move this way, I'm going to decrease this joint angle. It's going to get smaller. But if I curl my toes under like this, I'm going to decrease this joint angle. It's going to get smaller. So feet flex in both directions. So when they flex toward the shin like this, it's called dorsiflexion. When they curl under, or you point your toes like a ballerina, it's called plantar flexion. No other body parts do this. Now, newer books call plantar flexion ankle extension. And I think that is a much better way to describe this. And so if you come back and take this course in a few years, we may not be calling it plantar flexion anymore. It'll just be ankle extension. Another thing that only feet can do is similar to what hands can do when they supinate or pronate. But feet don't turn as far as hands do, and so we can't use the same terminology. So when you turn your foot toward the other leg, like this, toward the other leg, that's inversion. If you turn your feet away from the other leg, that's eversion. So instead of saying supination and pronation, we say inversion and eversion. So inversion, you turn your foot inwards. Eversion, you turn your foot outwards. This is a GIF that shows that, but remember, Collaborate won't do that. Okay, some body parts can move forward and backwards. If it moves forward, it's called protraction and retraction. Some body parts can move up and down. If it moves up, it's called elevation and depression. Most of the time when they use these, they talk about the mandible. And the mandible can be pushed forward and it can be pulled backwards. It can open and close or go up and down. But a better example of this, I think, is the shoulders. So if you think about your shoulders, so here's your head and your neck, and then you have these shoulders. Well, shoulders, you can raise your shoulders. Shrug your shoulders. You can raise them. That's elevation. You can bring them back down to where the normal position. That's depression. You can also make your shoulders go forward, like almost like toward your chin. That is protraction. And you can make your shoulders go backwards, like this, so that your shoulder blades, you're trying to touch them together. That's retraction. So it's perfectly fine to use the mandible as this example. Again, mandibles do move forward. They do move backwards. They do move up. And they do move down. But try it with your shoulders and you'll be able to see it much better. So what I'd like you to do here is go through and just kind of pick out as many movements as you can. Now these are all GIFs, and so they all actually move when you watch them. But just look at them and see if you can pick out these GIFs or these movements. And here's something you might see on a quiz. So look, you should be able to name what A is, what B is, and so on. And you should go through here and try to name all of these as well. So figure out what's happening here. Figure out what's happening here. What's happening here. And if you look at the arrow, it tells you the direction of the movement. So remember I was talking about the shoulder. And so look, you can see these movements that we were talking about. The shoulder can go forward, that's protraction. The shoulder can go backward, that's retraction. The shoulder can go up, that's elevation. And the shoulder can go down, that's depression. And then hopefully you can pick out these others as well. Any questions? So I'm going to stop that recording and we're going to move on to the next part.